Hey, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to be talking about orthodontic treatment for senior patients or older patients, the 60 plus crowd. A long time ago when I first started orthodontics, that was pretty much a one-off to have senior patients in orthodontic treatment. Why? Because we only had braces, and for the most part, they weren't necessarily healthy. There's a lot of breakdown, a lot of missing teeth. It was very difficult with braces to do this, and maybe I'd have one every few years, but now it's, people living longer, people wanting nice straight teeth for a lifetime, and a lot of patients are 60 plus, and I think that is absolutely awesome. So first of all, if you're interested in this topic, and by the way, I'm gonna school y'all since it's Friday, it's Aloha Friday. Kapuna is Hawaiian for senior patients, or seniors, older people we should respect. So you should definitely check out the post I just made on my blog as well as in my YouTube on periodontal patients and Invisalign or braces, because I'm not gonna recap on that. And I go way more into details clinically on that. But today we're just gonna lightly talk about, yes, people over 60 can have orthodontics, and you should have orthodontics. Definitely, if it's something that's healthy for you. Obviously, I recommend you go to your general dentist, get a full oral health evaluation, find out if your teeth and gums and bone is stable enough to move for orthodontics. Very often in 60 plus crowd, you are doing orthodontics not only to look nicer, but also to function nicer and to have your teeth and bite last a lifetime. So it may involve uprighting some teeth or scooting some teeth around so that you can get some implants or some nicer cosmetic work later. So it might be part of like a bigger plan. So you definitely want to be making sure you're working with a team that's collaborating. It all might be done by one dentist. Maybe your general dentist is doing the ortho as well as the restorative. That works really well. Or maybe an orthodontist is doing your ortho and working with your prosthodontist or your general dentist to do the restorative. But it's a bunch of teamwork, and it's really important. So for sure, I usually prefer Invisalign just because of the trim line. I think it works better. Things to think about, our existing restorations, how are we going to work around that? If you have abfractions, and if you don't know what some of these things are, you can go into my YouTube channel and type in the keyword, and I have videos on what all these things are. Again, these videos are for the most part made for dentists, and we're talking about things at a high level so they know what all these things are. But abfractions can be a little bit tricky. I've seen some crazy things happen with abfractions and orthodontic treatment. So that's why I like Invisalign, because their trim level is really adaptable. And it is less likely to kind of torque or snap the teeth when you try to take the aligners on or off. Some other aligner companies that are out there have a much more straight, much more gum level, higher up trim line, which can cause more forces as you try to take it on and off, which can cause teeth to snap that aren't supported. So for that reason, I really like Invisalign for senior patients, and definitely not braces. You can watch the previous video I did on periodontal treatment, why I don't agree with braces and senior patients. So again, I also think that they have really good Pontics with Invisalign. They have all different shapes and sizes, and they can kind of customize them. A few of the other more white labely, clear correct aligner companies, they only have like one size Pontics. It tends to look kind of ugly. Of course, senior patients often have some missing teeth in the meantime while they're working towards their Invisalign goals or their orthodontic goals. So it's nice to have nicely shaped Pontics. Remember, as a dentist, you need to fill the Pontics for the patient. I have a lot of videos on how to do that. It's really easy. You can go into my YouTube, type the word in Pontics for Invisalign, and it should pop up. And again, very slow, low forces. So dentists, if you have senior patients and you want help on a treatment plan, you're welcome to schedule an appointment with us. We do one-time appointments, up to 20 minutes, one case, and they're very affordable. So you can go to StraightSmileSolutions.com and click on services to schedule that appointment. All right, thanks so much. We hope that everyone is working towards nice smiles and great bites. Take care.